Good afternoon, everyone, and thank you for joining us today. On today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services at the Milwaukee County Office of Emergency Management, and Commissioner Kirsten Johnson, Health Commissioner with the Milwaukee Health Department. Thank you all for being here, and Milwaukee County Executive, I'll hand it over to you to get us started.
Well, thank you so much, Catherine, and good afternoon to everyone. I want to start today by addressing the recent news on the Johnson & Johnson vaccine. And in light of this announcement, Milwaukee County is pausing the administration of the Johnson & Johnson vaccine at our Kosciuszko Community Center vaccination site, as well as the Milwaukee County House of Corrections and the Milwaukee County Jail. Our health experts will continue to monitor the situation closely, and we'll continue to follow the CDC and the FDA's recommendations. And so pausing the administration of the Johnson & Johnson vaccine, it does impact the ability at which we can vaccinate individuals in our community, but it does not pause our efforts completely. And we will continue to administer the Moderna vaccine, and appointments are available to the public at our site and many others. And so if you want to review facts about the efficacy and safety of the vaccine or to schedule an appointment, please visit healthymke.com. And I would also say, don't let today's Johnson & Johnson news alarm you. Getting the vaccine is still our best option in fighting COVID-19, especially as we are experiencing a rise in case numbers throughout the county as well as throughout our state. And so until a greater percentage of our population is fully vaccinated, wearing a mask in public, avoiding crowded areas, and sanitizing when possible are still crucial tools in order to slow the spread of COVID-19. And I want to encourage everyone to consider how these practices affect your community, your family, and yourself. We all have a role to play in protecting one another. And one of the many barriers, particularly our underrepresented communities face, as well as rural areas, is a lack of access to the internet during this time where many are working from home or attending school virtually. And so because of this, the Federal Communications Commission has developed a program called the Emergency Broadband Benefit to help households struggling to pay for internet service throughout this pandemic. The emergency broadband benefit will provide a discount towards broadband service for eligible households. And eligible households can also receive a one-time discount to purchase a laptop, desktop computer, or a tablet from participating providers if they contribute more towards the purchase price. And this program has been authorized by the FCC, but the start date has not yet been established. They are working currently to make the benefit available as quickly as possible. So if you or someone you know meets any of the criteria for eligibility outlined by the FCC, please do not hesitate to utilize this program as it becomes available. And so if you're interested in seeing the eligibility requirements and to find more information about this program, visit fcc.gov/broadband benefit. Again, that's fcc.gov/broadband benefit. And lastly, I just want to acknowledge that tomorrow is 414 Day, otherwise known as Milwaukee Day. Our area code 414 represents home to thousands of people. And it's a day for us all to celebrate all of the incredible art, the sports, education, culture, community, and much more that makes Milwaukee one of the beautiful cities in the nation to not only live and work, but to also play. And it's also Milwaukee Black Restaurant Week. So consider patronizing Black-owned restaurants as you explore and appreciate our city. And with that, I'd like to hand it over to Mayor Barrett. Mayor Barrett.
Thank you very much, County Executive Crowley. And I want to follow up the County Executive's remarks about Johnson & Johnson. Not surprisingly, the city of Milwaukee is also pausing on using the Johnson & Johnson vaccination until this issue is cleared up. But I also want to echo the County Executive's comments. What we're experiencing right now is exactly how the system should work. When there is a problem, no matter how small the problem, I think that the federal government and the FDA is acting appropriately by pushing the pause button. And that's exactly what has happened here. So I remain very, very optimistic, obviously about all vaccinations, but certainly about Johnson & Johnson. But I also think it's important to sort of keep in mind the mix that we have had, because I think there's some question about that as well. Here in the city of Milwaukee, the Milwaukee Health Department has administered over 61,000 doses of the Pfizer vaccination, over 61,000 Pfizer, 19,620, probably up to 20,000 by now, because these are numbers as of last week, 20,000 Moderna, and 1,865 of Johnson & Johnson. So Johnson & Johnson has been by far the smallest number of vaccinations we have used. And we will continue to rely most heavily on the Pfizer right now, but we still have some Moderna as well. So please keep that in mind, and keep in mind that the federal government, and I appreciate this, is really looking out for the health of all of us when it's making sure that everything is safe. But the good news is that the decision is not going to affect our main vaccination sites at all. And Commissioner Johnson may talk about this a little bit more when she speaks. Another big change that we announced Sunday that is actually more concern to me is that the Wisconsin Center is now accepting walk-ins. Now, why are we accepting walk-ins? Well, the reason is pretty obvious. The reason we're accepting walk-ins now is because we have a tremendous supply of vaccinations, and the demand has not been meeting those vaccinations. And that is concerning to me, because we have done everything we can to make sure that we have got a plentiful supply of vaccinations, working closely with the state and with the federal government to make sure we have these vaccinations. We now have them. And after the first rush or the first flood of people who wanted to get the vaccinations, it has quieted down significantly. And so we felt that the best way for us to address that was to allow people to have walk-ins. And so the Wisconsin Center is now open 7 days a week, and it has a very large capacity of vaccines. It is open to all who work, live, or study in the state of Wisconsin. It's open Monday through Saturday from 9 a.m. to 6 p.m. And it's even open on Sunday from 8 a.m. to 4 p.m. And so for all of those individuals in our community who have been waiting or are waiting for a vaccine, this is your chance. This is the chance to come in and get the vaccination at the Wisconsin Center. But we have other sites as well. Our community vaccination sites at North and South Division High School are still available to City of Milwaukee residents ages 16 and older. Again, no appointment is necessary. From 10 a.m. to 4 p.m. Monday through Friday, just stop in either the North Division or South Division High School to get a vaccination. These community vaccination sites will be transitioning to the Northwest and Southside Health Centers next week as schools reopen. So we want to make sure, again, that we have available sites in the community as well as at the Wisconsin Center. We are also concerned about the rise in numbers that we have been seeing, but I want to announce that we will be holding off making any changes to our public health order this week. And again, the commissioner may want to talk a little bit about this. One of the main reasons is we want to put the focus as brightly as we can on vaccination. We want people to get the shots in their arms safely, expeditiously, and efficiently. And so we're putting so much effort into making sure that people get the vaccinations. We need your help to keep our numbers down. So please be vigilant and take the necessary steps to keep our community safe. Wear a mask, wash your hands, and watch your distance. And if you're feeling symptomatic or think you may have exposed to someone who has tested positive for COVID-19, please seek out testing. For those who are looking to receive a COVID-19 test at American Family Field, just a little reminder that as of Monday, testing has shifted to Monday, Wednesdays, and Fridays, and Saturdays from 9 a.m. to 3 p.m. to account for the baseball. And for those who have been there before, the location of the testing site has changed. It's now a little further to the east parking lot for testing. I think it's in the Young parking lot.
Right in the middle.
Finally, I want to echo the words of the county executive by sharing that tomorrow is 414 Day, or Milwaukee Day, as you may know it. And yesterday when we unfurled the beautiful, huge flag outside of City Hall, and it was sunny and it was gorgeous, I was thinking, I'm glad that our area code is not 211. It would not have been as much fun to unfurl that flag on February 1st, but fortunately, 414, middle April, we can handle it. But the 414 flag is proudly displayed outside of City Hall all week, and it's to celebrate our annual Day of Civic Pride for the city, for the county, for the people who live here. I want to encourage our residents to help protect our community by doing something nice to someone else this springtime, and also by getting your vaccination. So the more we can work to stop the spread of COVID-19, it helps our families, it helps ourselves, it helps our neighbors, and it helps our community as we seek to return to normalcy. So again, do what you can on this 414 week. And with that, I'm going to turn it over to Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we're currently seeing an average of 133 new cases a day and about 2 deaths every 3 days. We continue to see some sustained increases in our daily new case numbers, as well as our percent positivity, both of which have more than doubled in the last month. And our hospitalizations also continue to slowly but steadily rise as well, now with 81 individuals. We did see this morning that the FDA and the CDC, as well as the Wisconsin DHS, has recommended that vaccinators temporarily pause the use of the Johnson & Johnson vaccine while they further investigate 6 incidents of serious and rare blood clots. This action from these federal regulation and advisory agencies to pause and evaluate the Johnson & Johnson vaccine shows that the system is working as intended. And it demonstrates the responsibility and integrity of these agencies in reviewing the safety of these vaccines, much like all vaccines and all medications. This will hopefully be a brief pause in administration of this specific vaccine in order to learn more and ensure safety. One of the key items to understand with this review is whether these blood clots occurred by chance or were related to the vaccine. We know that a certain number of people in the general population get blood clots. When you give enough people the COVID vaccine, it will just so happen that some of them, by chance, will get blood clots. And that may be chance. It may happen shortly after receiving the vaccine. It may not be related to the vaccine. It may just be that they happen to be one of the people that would have had blood clots either way. Much as if someone gets the vaccine and gets in a car crash afterwards or the next day, it's probably just unfortunate luck and not necessarily related to the vaccine. But to really understand this, we have to look at how often these events occur in the general population and then see if they're occurring more often in those who are getting vaccinated. So what we're talking about in this situation is a rare type of blood clot called a cerebral venous sinus thrombosis, or CVST. So this is a blood clot in the area of the brain that helps to drain blood from the brain back to the heart. Now, these rare blood clots do occur at baseline, regardless of vaccination. And although rare, they do occur in somewhere between 2 and 15 people per million every year. Now, among the Johnson & Johnson vaccine recipients, we're seeing 6 cases in 6.8 million people that have received the vaccine, or about 1 in a million. So it's actually less than you'd expect to see in the general population. Now, that said, these 6 clots occurred in a relatively short period of time, and they had some unique characteristics that make them more concerning. All cases were in younger women between 18 and 48 years old, and all occurred 6 to 13 days after receiving the vaccine. So this pause by the CDC and the FDA is to determine whether these 6 events are a coincidence or if they could potentially be caused by the vaccine. So for those 160,000 people in Wisconsin who've received the Johnson & Johnson vaccine, know that you are at very low risk, and there's very little cause for concern. The Johnson & Johnson vaccine has been proven to be highly effective in preventing severe illness from COVID. It's been shown in studies to be 100% effective against hospitalization and death from COVID. And any serious side effects are extremely, extremely rare. We're talking 1 in a million. Now, that said, if you are a young female who received the Johnson & Johnson vaccine and you're a week or 2 out from the vaccine and you're experiencing severe headaches, abdominal pain, leg pain, or shortness of breath, contact your healthcare provider. While we will certainly continue to follow this situation closely, it's important to consider the benefits versus the risk of vaccination. So Wisconsin has a population of about 6 million people. Even if we vaccinated every person in the state with Johnson & Johnson, and even if there was this 1 in a million chance of a blood clot, we might see 6 people form these clots in Wisconsin. And given that about 80% of people historically recover from these types of clots without any complications, we may have 1 person with severe complications or who may die. That's an extreme worst case scenario in Wisconsin of 1 death. Now, in contrast, 6,680 people have died of COVID in Wisconsin. And even if we assume the worst about clotting and vaccine, the numbers are not even comparable. We will certainly hold off on administering the Johnson & Johnson vaccine while the CDC and the FDA review the safety profile. But know that Pfizer and Moderna vaccinations will continue. Our efforts to vaccinate and protect the citizens of Milwaukee County will continue. And the fact that vaccines are extremely effective and extremely safe will continue to be the case as well. So you can visit Healthy MKE to find vaccination sites near you. Thank you and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. Our gating criteria have plateaued over the past few days. As of today, our test positivity rate is 5%, and our disease burden is hovering between 80 and 90 cases per 100,000 people. These two data points put us in between phase 5 and phase 6 orders. Because of this, and because we are hopeful more people will be vaccinated, we are keeping the phase 6 order in place for the next 4 weeks. Please help us get vaccines in arms so we can focus forward. As the Commissioner of Health, I'm asking all of our community partners and businesses to do what you can to leverage your resources and encourage everyone you know to get vaccinated. We want to move forward. The Milwaukee Health Department has administered over 70,000 doses of vaccine at the Wisconsin Center and 12,488 doses at our community sites. Of those 82,000 doses, only 1,865 were Johnson & Johnson. We will continue our mobile and community sites using Pfizer, and the Wisconsin Center is primarily Pfizer as well. Currently, 18% of Milwaukee residents 16 and older are fully vaccinated, and 34.2% of our residents have received at least 1 dose, but we still have a ways to go. The Wisconsin Center is open 7 days a week, Monday through Saturday, 9 a.m. to 6 p.m., and Sundays, 9 a.m. to 4 p.m. You can register at milwaukee.gov/COVIDvax, or you can simply walk in. As of Monday, April 19th, we will be pivoting from North and South Division High Schools to the Northwest Health Center and Southside Health Center. Both sites are walk-in and open Monday, Wednesday, and Friday from 10 to 4, and Tuesdays and Thursdays from 12 to 6. There are many other vaccination locations listed at Healthy MKE, so you can see all of your options. Please continue to wear your mask, social distance, wash your hands, and get vaccinated. Thank you.
Thank you, Commissioner Johnson. I'm just going to give it a quick minute as I'm waiting for questions in the chat. I'm assuming we will have a few today. All right. Our first question is from Rose Schmidt with CBS 58. She asks, what would you say to someone who is now concerned about getting any of the vaccines following today's news about J&J? And how does the news about the J&J vaccine affect the county's campaign to build vaccine confidence? How do you think the news of the J&J vaccine will hurt the ability to fight the virus in minority communities, considering it's only 1 dose and it's been administered at one-day clinics in underserved communities?
So a few questions here to tackle. So one, anybody who's concerned about the vaccine, I would say that when the vaccines go through their safety trials, much like any medication, any vaccine, they're tested on tens of thousands of people. Now, when a testing is done on tens of thousands of people, these extremely rare events that occur, for example, like this 1 in a million, may not be caught. Now, it's important to remember that they're extremely rare events. And so when you weigh the risks and benefits, something that's 1 in a million versus COVID, and the complications, whether short-term or long-term of COVID, are much greater than that. I think, the vaccine obviously has significant benefits. So I would say that we do not need to be concerned about vaccines. I still would encourage any family member, any friend, anybody at all to get the vaccine. And right now, Moderna and Pfizer is readily available in our community.
And I would simply say, as Dr. Weston has alluded to, the problems that have occurred with Johnson & Johnson are 1 out of a million. In sharp contrast to that, 1 out of 10 people in Milwaukee County has been affected by COVID-19. So it's 1 out of 10 chances of getting the disease versus 1 out of a million chances of having this adverse reaction, which may or may not be connected to the vaccination.
Thank you all. The next question is from Christina Van Zelst with Fox 6. She says, what is the process for clinics who had the Johnson & Johnson vaccine, and how many clinics were affected in Milwaukee?
So the process for clinics in Wisconsin and really nationally at this point is to hold off on administering the Johnson & Johnson vaccine until more information is available. I think most clinics, including ours at Kosciuszko Community Center, will be reaching out to people who did receive Johnson & Johnson just out of an abundance of caution to let them know the signs and symptoms to watch for. Even though it's 1 in a million, we wouldn't expect to have anybody having any of these effects in Wisconsin, since we've only administered 160,000 doses, but certainly something to watch for. As far as how many clinics were affected in Milwaukee, that would be a question for the state. That data isn't available to us, how many clinics are receiving Johnson & Johnson right now.
Thank you, Dr. Weston. The next question, I believe, is for Commissioner Johnson. It's from Ben Wagner with WISN 12. He says, how many walk-in vaccinations have been administered at the Wisconsin Center so far? And this one is for anyone. Why do you think vaccine supply is now outpacing demand?
So I am not sure how many walk-in vaccinations have been administered so far, but just texted to find out. And as soon as I find out, I will let you know. And I think that I think we're in a great place in Milwaukee. We have a lot of vaccine, and we want to put it in arms. So we're actually in a good position.
Thank you, Commissioner. Stephanie Hines with TMJ4 is wondering, in general, which groups have received the Johnson & Johnson vaccine? I remember mentioning that some are being held for teachers.
I can take that. I can speak to what how we've used the J&J and at the Milwaukee Health Department. We did indeed hold some back for teachers. I'm thinking we maybe did around 200 teachers with J&J. We have used it at a handful of mobile sites. We used it with the brewers. We've used it at our shelters. So it's been a variety of different locations, but again, less than 1,500 total doses out of the over 82,000 we've administered have been Johnson & Johnson. And we have taken between 500 and 600 walk-ins in the last 2 days at the Wisconsin Center.
Thanks for the follow-up. Matt Martinez with the Milwaukee Neighborhood News Service is wondering, will vaccination sites not run by the city and county be required to halt administration? How will that be enforced if so?
The state has asked that vaccination sites throughout Wisconsin hold off on Johnson & Johnson administration until further notice.
The next few questions come from Allison Durr with the Milwaukee Journal-Sentinel. She says, how many Johnson & Johnson vaccines has the county administered? If that information is not available, why not?
So I'm not sure if it's asking the county overall or at our county site. Certainly happy to share both numbers. So at Kosciuszko Community Center.
Would you mind turning your camera on, Dr. Weston?
Oh, sorry about that. At Kosciuszko Community Center, we've administered about 475 Johnson & Johnson doses. That's out of over 10,000 doses total that we've administered. Countywide, we get data from the state on Thursdays and Tuesdays. On last Thursday, it was about 12,500 doses of Johnson & Johnson have been given in Milwaukee County. Looking at the data that's coming in today, it looks like about 16,000. We're still sorting through that data and doing some quality control on it. But that's probably about the numbers that we're looking at in the county.
Thank you. And the next several questions from Allison are for the city and county regarding the Johnson & Johnson pause. She asks, how many appointments need to be canceled and or rescheduled? How can Johnson & Johnson recipients from the city and county get any questions they now have answered? Is there a phone number to call? And do you have a dump doses? If so, how many? Do you have to dump doses? And if so, how many?
So taking those questions in order, I can start with them. So at least at our county site, we don't have designated Johnson & Johnson versus, we do Johnson & Johnson and Moderna. We don't have designated appointments. When people come in, we ask them which vaccine they preference and administer that one. We're not offering Johnson & Johnson at the moment, so it would just be Moderna. So there's no appointments that'll be canceled. That's specific to Kosciuszko Community Center. And I believe a lot of other sites are operating under that same setting. If people have questions, certainly calling the vaccination sites. Just all vaccination sites have phone numbers associated with them, including Kosciuszko Community Center. I think most vaccination sites will probably be reaching out to their Johnson & Johnson recipients as well with more information. And certainly not planning to dump every dose. Those Johnson & Johnson has a pretty long shelf life when refrigerated. And so we will, and the recommendation has been to maintain that supply, hold on to it, but don't administer it for the time being.
And similarly, we don't have to cancel any J&J appointments. We didn't have any specifically scheduled Johnson & Johnson appointments, so that's not impacting us at all. And again, as Dr. Weston said, you can call any facility that's administering any of the vaccine to have questions answered. And we are also just storing our Johnson & Johnson doses that we have on hand.
Thank you both. Sari Lusk with the Milwaukee Business Journal is wondering, for Commissioner Johnson, could you please further clarify your position on keeping restrictions as they stand? Last week, you said you would go with the higher indicator versus the lower indicator in the gating criteria. The disease burden puts the city in substantial transmission, just as it did last week when you shared how you would decide between the two phases. What has changed since then, leading you to hold on phase 6?
It's a good question. So we've been watching our data obviously very closely day by day. And what we're seeing is we had a blip where our cases were going up over the past 3 to 4 weeks. That blip has actually declined in the city and started to plateau. So I don't think now is the time to put in a more restrictive order, given our data and the way it's playing out. And because we're between the two sort of phases, between moderate transmission and substantial transmission. I just don't think now is the time. And I really want to focus our emphasis on looking forward and getting vaccines in arms. So partnering and leveraging our relationships that we have in the community and the city to please do what you can to get the people you know vaccinated.
Rich Revita with Milwaukee Magazine is wondering, are there any concerns about a potential COVID-19 outbreak with the Chicago Cubs, who are playing the Brewers at American Family Field? 2 coaches have tested positive and 3 players have been placed on the COVID-19 injury list.
The Brewers have a very restrictive plan in place and have since last year. I'm not concerned that there's going to be spread at American Family Field.
All right, the next few questions are from Sharon Bajenda with CBS 58. With the news of the Johnson & Johnson vaccine being put on pause, what is your recommendation to people who have already gotten the vaccine? I'll start with that question.
So the recommendation for people who've already received the Johnson & Johnson vaccine is to not be overly concerned. Your risk is still extremely low. You have much greater risk probably from most medications you take of other sort of side effects. You have more risk every time you get in the car of having a car accident, probably every time you walk outside your door of being hit by a car. So there's a lot of things that you have greater risks of. Now that said, you still want to be cautious. So if you fall into the right demographic, if you are a younger female, if you are 1 to maybe 3 weeks out from getting the vaccine, and certainly if you have symptoms, which will be concerning in and of themselves, severe abdominal pain, severe headaches, shortness of breath, leg pain or leg swelling that is new, those are things that you'd want to contact your healthcare provider about.
And the follow-up question is, other medications such as birth control seem to have a higher risk of blood clots than the Johnson & Johnson vaccine. Why do you think the FDA and CDC paused the Johnson & Johnson vaccine? And is it because the treatment for these blood clots differ than, let's say, blood clots from birth control?
So certainly certain types of medications, birth control, certain habits, smoking cigarettes have a very high risk, or much higher risk than this, I should say, of leading to the development of blood clots. Now, these are a very specific, relatively rare type of blood clot in that they're not your typical blood clots in the legs or in the lungs, but they're a blood clot in a very specific vessel in the brain. So they are unusual blood clots. They are rare blood clots. And they did seem to occur, even though they're exceedingly rare, 1 in a million, they did seem to occur in a short period of time. And so I think the reason why the FDA and the CDC are pausing is to better understand that so that they can better communicate the risk profile. Even if it is a 1 in a million risk, what the risk profile is with these vaccines, just like we communicate side effects and risk profiles with any medication you take.
Stephanie Haynes with Team J4 is just asking for clarity on, from the city, how many Johnson & Johnson doses have been administered?
So the City of Milwaukee Health Department has administered 1,865 doses.
Thank you. And a follow-up question from Ben Wagner at WISN 12. He's wondering, related to the health order, why the decision to remain at phase 6, which I believe was discussed. But the follow-up is, has the health department received any complaints or concerns from businesses which would have been affected?
So we work really closely with our business partners and other organizations, and I can tell you that we get feedback both ways, that there are organizations that want more restrictions in place and others that don't. And again, we really follow the science. We're following our data. We're following what the CDC has put out there and looking at our numbers.
Rose Schmidt with CBS 58 is wondering, there has been a fair amount of vaccine hesitancy in minority communities that we've discussed in the past. How does the news today about the Johnson & Johnson vaccine affect this?
I mean, personally, I think that, when you talk about putting a pause on the J&J vaccination may cause some other people to pause getting the vaccine, but that's why we're talking about the efficacy and the reason why to still get vaccinated. And while, again, this is a 1 in a million chance when you think about these blood clots, we know that in order to crush COVID, we have to get this vaccine in order to get to a place of normalcy. So that's why we continue to do these COVID briefings, to let people know what the facts are out there, and hopefully they can make an informed decision as to why they should or should not receive the vaccine.
Thank you, County Executive. Those are all the questions I'm seeing for, Telemundo does have a question, but at this point, those are all the questions I'm seeing for our regular portion of the media Q&A. So I will let those drop off who won't be joining us for the Spanish portion of our media Q&A. Just give it a few minutes and then I'll go ahead and ask the Telemundo question.